In sub-Saharan Africa, type 1 diabetes remains a life-threatening condition. Late diagnosis, limited access to insulin, weak health systems, psychosocial stress, socioeconomic strain place children at constant risk. Families are left to manage a complex chronic condition with few resources. Meet Abdu. He is 6 years old. His father earns the equivalent of $1.20 a day on a good day selling vegetables in the market in Bukadia, Uganda. His mother is unemployed. 3 months ago, he was diagnosed with type 1 diabetes. When Abdu was diagnosed, the first reaction was to pray the disease away. They did not know where medicine would come from, so they prayed as Abdu grew weaker.
Alulu kaniyo gama sigese na okubazaga kubaga mudikini bubiri nira ko gano nago budatu mukaga gano mukaga anenga amale kulya kyegumusi ndina kuba uno bubiri tane kye angolobe gano nago nakuba bubiri nakuba uno budatu.
Meet Jane. She is 8 years old, the last born of 4 daughters. Her single mother earns about $1 a day at the market. She believed education was the family's path forward. When Jane was diagnosed, everything changed. School stopped for all 4 girls. Resources were diverted to keep Jane alive. For this family, the choice became health or education.
Tuliwo tulabirira mwana tuone embera giye bamesawo ejo bakobere nto mwana mulwero wa sukali mwidwariro neralikirira nto mwana nga akufwa n'abasawo ne bangumya bato omwana twakumuwa malezi ate ano uyambi uno bampa basawo mwidwariro kitegeeza nti bantaka akasente kanake nakubere ngangula amalezi ingulira mulwaire byakulya ne byakunywa ndi mugumu kubanga omwana aliko abasawo abali kumujanjabya bamuyambako transport ne bamuwa malezi tingula uguli era nimba ninakuwala ino nekimpa ugumu.
Meet John Peter. He is 15 years old, the oldest boy in a family of 7. His mother sells produce to feed them. Clothing is a luxury. Type 1 diabetes adds another burden. The nearest clinic is in Soroti, 3 hours away. Most of the trip is on foot. Alice is a grandmother, the primary caretaker of her 3 grandchildren. Jalia, 8 years old, Abdullah, 10 years old, Abibu, 15 years old. All 3 were diagnosed in quick succession of each other. The condition is breaking the family. They live in a remote district. Across Africa, tens of thousands of children face this same reality. The Sonia Nabita Foundation, SNF, was founded to support children like Abdu, Jane, John Peter, Jalia, Abdullah, and Habib, who are managing type 1 diabetes under severe economic, social, and health system constraints.
I'm Nurse Napas Rosemary from Bale Regional Referral Hospital. Okay, now for example, when we go for home visits, we move with our drugs. So the children we have done home visits, they don't come to the clinic. Those we have visited, we give the supplies there. If their HbA1cs are well controlled, if they are well controlled, they don't need to come to the clinic all the time. We deliver the drugs.
For warriors like John Peter, distance no longer decides access to care. Insulin and supplies reach his community. Support is designed so treatment does not stop because a clinic is far away. Access and continuity of care are built into how SNF works across 41 clinics in Uganda and Ghana. Clinics are overstretched. Nurses run clinics as there's no specialists. Uganda has 4 pediatric endocrinologists. Ghana has 4. So clinics need support and capacity. This is why the Warrior Education Program is critical. The Warrior Educators help support the growing number of warriors at the clinics and connect medical care to daily life. For families like Abdu's, support comes to the home. Warrior Educators train peers who manage type 1 diabetes themselves, bring care, knowledge and guidance directly to where children live and ensure no child is lost between clinic visits. For Jalia, Abdullah and Habib, camps provide structured peer support. Warriors meet others living with type 1 diabetes. They share experiences, learn practical skills and build confidence in self-management of their condition. At SNF, psychosocial support is a proven intervention that strengthens adherence and improves clinical outcomes. For warriors like Jane, scholarships keep her in school. Literacy and numeracy strengthen her ability to manage type 1 diabetes. SNF's programs create a pathway so children like Jane can grow into adults who support themselves, manage their condition and contribute to their communities. Hudson walked the same path. An SNF program graduate, he is now a biomedical technician repairing donated glucometers. His work ensures life-saving devices last longer and donations stretch further. These programs reach thousands of warriors and the need continues to grow. To strengthen care for the future, SNF has built a comprehensive campus for children with type 1 diabetes, a centre where quality standards of care can be developed for low-resource settings, an institution to train nurses and health workers in type 1 diabetes care for the wider region, a base for research, data and innovation that improves outcomes beyond Uganda, a residential school where children like Abdu, Jane, John Peter, Jalia, Abdullah, Habib can receive formal education and gain practical skills without families forced to choose between health and education.